Good afternoon, everyone. My name is Shreya, and I am a behavioral therapist at Suchitra One.
My name is Visya. I am behavior therapist. Suchitra Part 1.
Today we are going to discuss about the importance of behavioral therapy for people on the ASD, which is autism spectrum disorder. So, ASD, like I said, stands for autism spectrum disorder. Previously, it was known as autistic disorder, but DSM 5, which is the Diagnostic Statistical Manual for Mental Disorders by the American Psychological Association in 2013, in their fifth revision, stated that changed it basically to ASD, suggesting it's autism spectrum disorder, and under it comes autistic disorder, pervasive developmental disorder, Asperger's, and childhood disintegrative disorders and Rett syndrome. But due to a new revision, that is DSM 5-TR, Rett syndrome and Asperger's have been taken out from the spectrum of disorders because they have been quantitatively found that they do have a genetic component to it. So, currently, under ASD, it comes as autistic disorder, pervasive developmental disorder, childhood disintegrative uh, disorders. So, what is ASD? So, ASD is basically a spectrum of disorders relating to neurodevelopmental malfunctioning. Okay, so neurodevelopmental malfunctioning suggests that during a certain point of development, either it could be natal or it could be postnatal, that has led to certain changes in the brain chemistry, might be also structure, that has lead to these individuals form certain kinds of behavior, um, and this like makes them different. One of like some of the major symptoms for ASD is doing repetitive and restrictive behavior. It can be actions like flapping of hands, blinking eyes, and it could also be speech, like saying something repetitively or repeating whatever is, asked to them instead of answering back. Then they have difficulty with socialization. They have a lot of socialization issues. They lack social reciprocity, which is basically suggesting that they do not know how to socially respond to, like maybe initiate a conversation or play with other children. And they also have difficulty in understanding, developing, and maintaining any kind of relationship, because that is one of the things that they are unable to like basically understand. So it becomes difficult for them to like go with it. So apart from that, there can be a hyper or a hyposensitivity to sensory inputs, suggesting that either the child gets like very much in distress when they hear loud noises or certain loud colors or lighting, and on the other hand of the spectrum, they might not react in an normative way to pain. And apart from that, they also have a tendency to like familiarity, suggesting that they like things a certain way. They like it when things are in a particular routine. They do not like when you change certain things. It gives them a lot of distress. Yeah. Apart from these symptoms, there are certain signs which most people on the ASD spectrum have. They are stubborn, they lack eye contact, they might have difficulty in motor coordinations, and they have difficulty in cognitive spheres. Okay, so now in the cognitive sphere, it's not necessary that every child who is on the ASD spectrum will also have some sort of cognitive difficulty. But yes, most of them do have certain cognitive difficulties associated to them. Uh, so, according to DSM, these symptoms have to be present for a period of 6 months for a professional to give a diagnosis. And then, apart from that, um, these autism is generally diagnosed around the age of 12 months to 18 months. Some might develop normally till they're 18 months, and then suddenly there is either regression or they do not develop as like they're supposed to be. So in those cases, they can get a diagnosis at 24 months also. So by 3 years, generally, if someone is autistic, they might will get a proper diagnosis from a healthcare provider. Apart from that, sometimes it is difficult for people to have access to such resources or information. So there can be a lot of adults and adolescents who get diagnosed with ASD much later in life. Then, apart from this thing, there are certain specifiers for like ASD. Like they might have certain general specifiers, like like no motor skills, or they might have eye contact issues. They might have like trouble with socialization with peers, and as well as others. They might not have name call response. And then there are specific specifiers, which is like age, the age in which they this onset of a symptom the parents noticed. If there is any sort of genetic component underlying it, if the child has downs, or if the child has fragile X syndrome, then that is one of the like specific specifiers. And then apart from that, the proper causes of ASD are actually not known. There is a lot of research out there about it. And yes, but one of the important things is that it has been conclusive that ASD has a genetic component to it, suggesting that if the child has some sort of a genetic mutation or genetic abnormality, like Downs or Fragile X, then there is a chance that the child might be autistic. Apart from this, if the child has a sibling who is on the spectrum, or if there is immediate family who is on the spectrum, then the chances of the child being on the autism spectrum increases. Then apart from that, there are a couple of environmental factors that play a role, like the age of parents. Older parents, the children of older parents have a much higher chance of like being on the spectrum than people who have kids when they are young. And then there can be some birth complications also, like when the child is like severely underweight during birth, or there is insufficient oxygen during birth, or like any other kind of natal, pre and postnatal complications. So the causes are not properly known, but the one thing that we do know is that we have levels. We have levels of autism. So we have level 1 to 3, in which 1 stands for mild and 3 is like severe autism. So for mildly autistic people who lie on that spectrum, they need very less support compared to the rest of the spectrum. They will most likely not have any sort of cognitive difficulty. They might rather have things like socialization issues or eye contact problem, things like that. Then people who come on level 2, that is moderate autism, uh, people like that will need substantial support, and for them, they might have or might not have cognitive difficulties. Also, they will require much more help regarding social skills, interaction skills. They might not be willing to even interact as much as someone who might be mild compared to. And then people who are on the severe end of the spectrum require a lot of support and a lot of help. They will not have any kind of socialization skills. They will not have social reciprocity. They will not have like eye contact. They will most likely have some sort of cognitive difficulty that is associated. They won't have a name call response. So people on the severe end of the spectrum need a lot of support, as well as like resources for both the child and the parent to properly like empower themselves. So apart from that, the diagnosis for autism should always be given by a licensed professional, because like I stated earlier, like DSM says that these symptoms have to be present for a period of 6 months. So there is a particular way, a systematic way of history taking to find out if these symptoms were present at that time. And so never like diagnose a child by yourself. If you think that you know someone who might be on the spectrum, you can tell the parents to take the person, or you can tell the person if they are older to like visit a licensed professional, talk to them and get a diagnosis, because it might be more likely that they might not be autistic but just be having certain symptoms. Like, for example, like people with autism have repetitive and restrictive behavior, right? So do people who have OCD, which is obsessive compulsive disorder. They also engage in repetitive and restricted behaviors. So it is always better to get your diagnosis from a professional, rather than like giving a diagnosis by yourself. So apart from that, there are certain types of ASD. Not types, they are like like come under the spectrum of ASD. So it is autistic disorder, which I talked about, pervasive developmental disorder, which suggests that the child will have certain abnormalities regarding his or her development. And then there is Asperger's, which is known as high functioning autism. There is childhood disintegrative disorder, and there is Rett syndrome. So, according to DSM, which is the Diagnostic Statistical Manual of Mental Disorders by APA, the American Psychological Association, they said in 2013 that they will put all of these into one term. Like, instead of having separate disorders, all of them came under one umbrella term of ASD, Autism Spectrum Disorder. However, there was a recent revision in which Rett syndrome and Asperger's were taken out of the list, because it was found that these two conditions specifically have a genetic component to it. So now they come under a different criteria. So, apart now that I have given a basic idea about what autism is, we shall move on to talk about what is BT? So, BT is the short form or the acronym for behavioral therapy. So, behavioral therapy follows the ideology of behaviorism, which is a school of thought in psychology, which was started by Watson. And in that, it is believed that behaviors are learned from the environment. They believe that behavior is whatever is visible to us without taking into consideration the mental or internal insights. So, BT or behavioral therapy specifically follows or was, like popularized by Thorndike, and BT suggests that we can change learned behaviors in the similar manner like we learn anything. Like any behavior that is learned can be unlearned or can be replaced by a more productive form of behavior. So, now why is BT necessary for ASD? So, like I said, people with ASD have certain difficulties that cannot be dealt with properly through the other schools of thought or the other techniques that are available to us, because the other techniques require someone to be very verbal, they require someone to have some minimum cognitive functioning. And since this therapy is particularly focused on behavior, it works very well for children, especially kids from the age range of 18 months to let's say like 36 months, because in that age a child is more ready to learn and it's more easier to like teach them things. So that is why BT is very important for these children on the spectrum, because it helps, because these children are non-verbal. First of all, most of the time they are non-verbal because they do not know how to socialize, they do not know how to properly express their emotions. They have certain tendencies, like like I said, like stubbornness, or they have like temper tantrums, or like self harming issues, because like I said, they might have a like a hyposensitivity, so they do not understand pain in a way like we would, you know. So for them, BT is really effective. And there are a lot of BT is like an umbrella term. There are a lot of different techniques under it. There is ABA, applied behavior analysis. There is behavior modification, exposure therapy, play therapy. There are a lot of different therapies, and I will talk about them. So let's start with ABA, that is applied behavior analysis. So ABA basically focuses on changing a child's behavior by motivating them with certain rewards to like replace the maladaptive behavior with a more functional pattern of behavior. But the major thing about ABA is, according to research, ABA was a technique that was developed in America. So the research is very, very much enclosed in that particular country. So there are some sort of generalizability issues with applying ABA across cultures, because there are cultural differences between like India and the US. So for India specifically, because of the cultural differences, it is much more useful if we do behavior modification. So behavior modification relies on two major principles: reinforcements and punishments. So, reinforcements is giving the child something that will motivate them. Motivating, we call it positive reinforcement. So, in positive reinforcement, suppose, for example, if a child is, like, okay, so we are back again. So we're talking about reinforcements. So reinforcements are basically uh, motivations that are given to the child to either engage in a certain behavior or to dissuade them from engaging in that said behavior. So there are two types of reinforcements: positive reinforcements and negative reinforcements. Positive reinforcements, in this, a child is given a reward when they do some activity that we would like them to do. For example, um, if a child is having some trouble with eye contact and you want the child to give you eye contact, so when the child gives you the eye contact, you can reward the child by either saying good job. It can be verbal, or it can also be physical, by suppose like giving them chocolate or giving them whatever they would, like, is their preference, they would like to eat. Then there is negative reinforcement. Now, negative reinforcement basically suggests that you take away something from the child when they do not do a certain behavior, they do not engage in that behavior. So, for example, if the child has a favorite toy and while doing, like, he's not doing a activity or something, you can take away that toy from that child and you can tell the child that I will only give you back this toy if you, like, like, do the activity, right? Then apart from reinforcements, like I said, there is punishments. So punishments also are two types: positive punishments and negative punishments. Positive punishments are punishments in which we do something that will be good for the child. It won't disrupt or distress the child. So, for example, if a child cries uncontrollably, but, like, like, for no reason, if they keep continuing, like, continuously crying for a very long time with, like, no reason, because, like, maybe it's a temper tantrum, it could be because of their stubbornness. So what you can do is you can, like, take a lemon and put a few drops of lemon in their mouth. That is a positive punishment, because we are not disrupting the child, we are not harming the child in any way. We are making the child associate lemon, the taste of lemon, with uncontrollable crying or a behavior that we do not appreciate. So, once that association is made, the child will, like, not engage in that behavior even when a lemon is just present. But after that, we have to do the fading so that the association does not become permanent, which is also necessary. We'll talk about fading later. So that is then negative punishment. So now negative punishment is something that is not used, it is not generally used, it is not advisable to use. But since we are talking about behavioral therapy, I'll just let you all know what it is. Negative punishment is doing something towards the child that will put them in certain distress, something that they do not like. It could be, like, like, maybe flicking them, or using a stick, something like that. But it is definitely not advisable to do this, because then the child will be more scared than actually, like, understanding, like, he's doing something wrong. He'll just be scared of the fact. And those associations are also very, like, maladaptive. Like, they can lead to other things. They can get, like, comorbid conditions, like they might get anxiety, they might get depression, they might get anything, they might get nocturnal aneurysis, anything they can get. So these are the concepts that are in behavior modification. Then we're going to talk about exposure therapy. So in exposure therapy, what basically happens is that the child is kept in a social environment which can have other children of their age group, as well as there might be more than one moderator or therapist present in the scenario. Parents can also be there. So in that, what happens is the child learns how to interact with his fellow peers, as well as how to interact with other people in a social setting. Because most of the times it can, what can happen is that a child might be, if I am a therapist and I have a child with me, the child might be comfortable with interacting with me inside the office, but once he gets outside the cabin, he might not be that like interactive with other people. Okay. Or a child at home might be very interactive with their parents, siblings, but if when they go to school or when they come to therapy or in any social scenario, they might have trouble. So that is why exposure therapy is important. uh, then, apart from exposure therapy, there is play therapy, which suggests that we can use, like, since these children on the spectrum, they will have certain problems with attention and everything. So it is easier for them to learn a behavior if it is learned through certain activities, right? So I'll give you some examples. Like, for example, for eye contact, there are a lot of activities for eye contact. One of them is called lacing the butterfly. Okay, so what there is a butterfly and it has holes in it, which are divided equally, and then there is a needle with a thread attached to it. So what the child has to do is, the child has to put the needle through the hole and lace the butterfly, make a pattern with the make the pattern along the lines, basically. So for that, what you can do is, you can hold the butterfly to your face, and only you can call out the child's name, whatever the name is, and you can be like, ask them to look at you, and only when they look at you, you allow them to put that thread in and you pull it. You can also do beading for eye contact. Then for example, if they are having trouble with attention, you can do pegboards. You can do pegboards like mushroom pegboards, with like small minute holes in which they have to put the pegs in. Or you can start with a much like a bigger landscape with, like, like a big pegboard for like animals or things like that. So that's like for attention. You can teach them, like, waiting tolerance. If these children do not have a waiting tolerance, then what you can do is, you can make them sit and in middle of the activity, and you can ask them to wait until the next command is given to do whatever. So yeah, so that's about play therapy. Apart from that, there are certain assessments that are also done for people on the spectrum. So it's in India, we have our very own scale, which is ESA. It stands for the Indian Scale for Assessment of Autism, and in that there are a lot of different criteria for different things, like physical, there is social, emotional, developmental, and marks and all that. And that is the Indian scale that we use for, you know for autism or people on the spectrum. Apart from that, people need BT, because as a therapy in itself, these children have a problem, and they cannot, first of all, they have a problem, they cannot, like verbally let you know. They might not even have non-verbal communication, which is that good. So in BT, it is easier to, like to teach them to engage in certain behaviors, and these behaviors are repeated. And according to the principle of behaviorism, when a particular behavior is repeated over time, that behavior sticks. That behavior is the new behavior. It is either it's like a replacement to something that was maladaptive earlier, with something that is gonna help the child, or something new that the child is going to learn about. So, the importance of BT also lies in the fact that, like I said, this is the age group in which children are very susceptible. It is the golden age for them to learn. So, early intervention always works. And in behavioral therapy, the therapist will not only, like focus only on like certain behaviors, but they will also focus on, like if that child is under some sort of emotional distress of any kind, if they're undergoing any sort of, like anxiety issues, or they have like like depressive symptoms or anything like that, the therapist will be able to pick up on it earlier, because like I said, these conditions are comorbid, suggesting that they might exist together with ASD. And apart from that, there is also ADHD, which is like attention deficit hyperactivity disorder, and that is also comorbid. So, behavioral therapy is very important because it focuses on particular aspects of the child, as well as the holistic development of the child into a more empowered individual who is more independent, who is more capable of understanding not only their own emotions, but also how to express them, how to like understand other people's emotions, and also like respond back to it. So yeah, that was the session for today.